Hi everyone, welcome to Oral Debrief on FMP2 deliverable 4. This is the diagnosis of hypothyroidism of a young patient. Adolescents often develop the endocrine disorder hypothyroidism as Hashimoto's thyroiditis, which manifests through fatigue alongside weight gain, co-sensitivity, and slowed mental processing. Medical tests together with physical symptoms pinpoint hypothyroidism as the patient's definitive medical diagnosis. A TSH reading measuring 8.6 alongside free T4 level at 0.6 validates primary hypothyroidism because TSH serves as a pinpoint indicator for thyroid abnormalities. Again, anti-thyroid pyroglys (TPO) detection confirmed the autoimmune nature of the condition since Hashimoto's thyroiditis stands as the main cause of hypothyroidism in adolescents. The patient's thyroid ultrasound also displayed an echotexture pattern with minor enlargement, which corresponds to the findings of chronic autoimmune thyroid disease. The chosen tests for diagnosis depend on their accuracy to identify hypothyroidism and exclude other possible conditions. That's the rationale for choosing this choice of diagnosis. TSH and free T4 laboratory results demonstrate inadequate thyroid hormone production because TSH value is increased while T4 concentration decreases. Tests for anti-thyroid pyroglys antibodies provide a definitive confirmation of Hashimoto's thyroiditis while excluding other potential hypothyroidism origins. The thyroid ultrasound showed heterogeneous echotexture alongside mild tissue enlargement as signature features in autoimmune thyroid disease. Other conditions have been ruled out systematically. Depression alone cannot account for bradycardia, dry skin, and constipation, whereas normal insulin, glucose, and CBC tests results rule out PCOS and anemia. So the diagnostic procedure shows how systemic approach help pediatric endocrinologists find the correct diagnosis for endocrine disorders. The timely discovery of hypothyroidism plays a critical role in stopping the development of cognitive disabilities and metabolic problems. A key learning point from this case shows that healthcare providers should watch for hypothyroidism indicators even when symptoms are not obvious. Although muscle weakness and excessive sleepiness may not point to hypothyroidism immediately, they match the metabolic slowdown effects of thyroid dysfunction. So better awareness of this visual hypothyroidism manifest would lead to improved diagnostic outcomes in upcoming cases. Patient education also proved to be a crucial aspect of care delivery during clinical scenario. The patient and her mother received information about how hypothyroidism requires perpetual management as well as daily medication maintenance, along with understanding how thyroid hormones affect overall health quality. In clinical settings, it has been proven that patients experience better health outcomes with improved compliance and provided appropriate patient education about their condition. So, in conclusion, overall, this case study demonstrated the multiple factors needed to diagnose hypothyroidism in adolescents, where clinical evaluations must be supported by laboratory results and imaging tests. So the structured diagnosis process built on evidence-based practice will enhance my future ability to manage similar cases. Continuous pediatric endocrinology education together with interdisciplinary healthcare collaboration will build superior patient treatment results. So the broad health consequence of untreated hypothyroidism led me to acknowledge that proper diagnosis and management should be prompt in primary care settings. Thank you for listening and watching the video.